This is Caring for Kids on News Talk 760 WJR. Presented by the Children's Foundation. And here's your host, President and CEO of the Children's Foundation, Larry Burns.
Okay, thanks, Mark. Hello, everyone. Happy spring, and welcome to our April 2021 edition of Caring for Kids. This is our 51st episode. Tonight's show, we're going to have a great lineup of local leaders who are all playing an important role in advancing the health and wellness of children and families. Joining us will be Dr. Colleen Allen, President and CEO of the Autism Alliance of Michigan. Dr. Stephen Craig, CEO of Surgeon's Choice Medical Center and the owner of Craig Counseling Services in Bloomfield Hills, and Gigi Colombini, psychotherapist and mental health expert. It's all coming up next on Caring for Kids, here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Welcome back, everybody. With me in our studio is Dr. Colleen Allen. Dr. Allen is President and CEO of the Autism Alliance of Michigan. In this role, Colleen has spent the past 8 years engaged in advocacy, programming, and training for families and service providers to improve access to critical services, support, and employment opportunities for adults with autism and related disabilities. Colleen was appointed by Governor Snyder as the inaugural chair of the Michigan Autism Council, a division of the Department of Health and Human Services, in 2012. In 2017, she was appointed to the State Developmental Disability Council and the Detroit Workforce Development Board. Colleen received her bachelor's from the University of Michigan, her master's in speech and language pathology from Boston University, and her PhD from Wayne State University. Colleen, welcome to Caring for Kids. So, Colleen, welcome to Caring for Kids. Thanks for being with us in person. We're both vaccinated, so that's a good thing. Mm-hmm. So, I know you recently had your annual conference, and it was virtual, like most of these things. And so, how did that go?
Very well. Exceeded our expectations. And thank you to the foundation for supporting our third year in a row, I think.
Yep, I think so.
And to your comment there, parents and professionals, I think, are feeling really overwhelmed by virtual everything. So we were concerned going into it that we wouldn't have the level of participation as prior years, but we actually exceeded prior years. We had over 700 families that were registered. 300 actually attended that day.
Yeah, that's terrific.
Which is great. And the fact that it was recorded means it's accessible to all of those who had registered that maybe just didn't get a chance to participate that particular day.
Yeah, that's, I think, one of the good things about having it virtual, that it lasts a bit longer than if it was just live.
Exactly. And we had, honestly, the information, the resources, our goal is to get that to families. And most importantly for us is we saw an increase in contact to our navigators in the following week. Mm-hmm. That was up about 30% from a typical week. So it means families reached out for extended help even beyond what was offered at the conference.
Congratulations, and we were delighted to be involved again. It'll be nice when we can do it live again, and maybe there'll be a combination of recording stuff as well as having it live. But
exactly.
Count on us to be your partner moving forward. So, talking with Colleen Allen, President and CEO of the Autism Alliance of Michigan. For our listeners that aren't that familiar with your organization, tell us a bit more about the Alliance.
We are a statewide professional organization. I always try to make clear that we are professional. Our program staff are master degreed and above in various autism fields. And when we were founded, that was really important to us, that we would be a professional, evidence-based source of information for families that were really either new to the diagnosis of autism or challenged with a lifelong concern that maybe hits in adulthood around employment or independent living. We do serve the entire state. We provide our services at no cost to families. And our flagship program is our Navigator program. And from that, we have identified critical gaps in services across the state based on what the questions, concerns that are coming to us from families all over. And so our community outreach program is really about training our first responders, for example. We've now been able to bring that training to over 25,000 police officers, EMS, fire, community workers. And our goal there is inclusivity and beyond awareness, really acceptance, inclusion, and families coming out of isolation and feeling that their community supports them. And then last is our employment program.
That's terrific. So the Navigator program, as I understand it, as a person that has had the opportunity to meet with you and others and know more about autism than I did 3 years ago, navigating what to do when you think or you know your child has been diagnosed with autism and turning to the right places is one of the things that you do best because it is a very trying time for a mom and a dad, correct?
Absolutely. And when we were founded, that was before autism insurance legislation and a Medicaid benefit. And the autism market was almost non existent in terms of where to go for services. And we thought at that time, getting families to what they need was challenging. It's even more difficult now because there are so many treatment approaches and helping families understand what's uniquely appropriate for their child
Their
is what
child.
we do best.
Yeah.
And helping families to see that you may have called about a clinical question or an insurance question. Inevitably, you're going to have a special education question. There may be safety concerns that we want to explore. So it's really looking very holistically at the child, the family, and in some cases, the adult around what they need in an unbiased, non-service providing approach. We're not selling anything. I'm not
Right.
trying to bring you in for therapies or support groups. It's really just to get you very specifically as a family what's needed.
Yeah, and you said family several times, and that to me is key. The Children's Foundation now is much more focused on families with mental health, with just about everything, because the family is so very, very important to a child, a young adult's life, and it has such an impact. So I commend you for
Absolutely.
that. Now, the last year or so, we've been in this pandemic environment, and I know in talking with you, this has caused some additional concerns. So tell our listeners about the Autism Alliance in the last year, and then what you're seeing and where we hopefully go from here.
Well, we have been busier than ever. Again, talking about our Navigator program, what we have seen are far more complex cases and cases that are not easily solvable. And those families that are struggling with a child at home, a child who had a baseline behavior issue that over time has just escalated. We're talking about a population with social, communication, behavioral challenges, now in a situation where routines are disrupted. That need for sameness and predictability is, really been blown up. Families that are trying to hold it together with jobs. So the combination of special education programming, disrupted therapy routines, and escalating behavior has resulted in a significant increase in cases where we're looking at a system, a broken system. We can only navigate to what's available.
Right.
And when a child or adult has already landed in an emergency room due to a psychiatric crisis that has really prohibited them from participating in community, number one, in school, or even being in their own home is the most challenging and what we've seen increasing over the past year.
Yeah, that's for sure, because our partnerships with the likes of Children's Hospital of Michigan, Mott Children's Hospital, they're indicating that there's more and more of those children in their ERs in a crisis. And it might be a multidimensional crisis.
That's right.
And there's just not enough good places to direct them to.
That's right.
As you know, and hopefully our listeners know, the Children's Foundation is really dedicated to helping find and create more places where a child, a young adult like that's in an ER can go for continued treatment. And so that need, your opinion, and that need is great.
Absolutely. And I guess I look at sort of the spectrum of supports that are needed when somebody is in crisis. There is a prevention component or stabilization, getting ahead of it long before those behaviors escalate. Then there's sort of right in the middle, right? Either this is a child who is now landed with law enforcement or in an emergency department. And then there's what happens after,
Right,
and
right.
in the after piece, in many cases, is just as critical for us to address because with quick fixes, like let's just change up the medication, you just have those kids coming right
Coming
back
back,
in.
right.
So what we do in terms of connecting to community supports and effective approaches so the family doesn't end up in that crisis again is really critical.
Yeah. So the last question I have for you is, what can philanthropic organizations or philanthropic people continue to do to help this issue, particularly with the Children's Foundation's interests? So are there particular things that we can do to help this environment?
Helping, certainly supporting models for effective practices that really minimize or reduce these sorts of situations is critical. I think from the philanthropic community, from the Children's Foundation, really looking at a model that eventually can be brought to scale. We're a statewide organization, so we're always interested in what works locally, but what we can also use to replicate so that other health systems, other community organizations can really replicate that work. So that piece, funding like just a model that could
Right.
work.
Right.
I think we don't have that yet and really need it. And we really would love to be part of the solution. And I think looking critically at the prevention piece, like getting ahead, how do we find these kids with early red flags before these crises escalate and help those families in the approaches needed? So it's an expensive and in some cases inhumane endeavor for a child to have to go through psychiatric crisis.
Yeah. Well, we definitely are committed to helping your organization, along with our other partners that you work with, to one step at a time try to solve this issue. And we love building programs that can be duplicated. So that's music to our ears as well. So I look forward to continuing that conversation. And I look forward to our partnership continuing. So, Colleen, Allen, thank you very much.
Thank you very much.
Yep,
and
thanks
for your support.
You're welcome. It's our pleasure. That was Dr. Colleen Allen, President and CEO of the Autism Alliance of Michigan. Coming up next, we're going to hear from Dr. Stephen Craig, CEO of Surgeon's Choice Medical Center, when Caring for Kids continues, here on the great voice of the Great Lakes. News Talk 760 WJR.
Welcome back to Caring for Kids on WJR, presented by the Children's Foundation.
Welcome back, everybody. Larry Burns here, Caring for Kids. And here with me in the studio is Dr. Stephen Craig. Dr. Craig is the CEO of Surgeon's Choice Medical Center. He's also a clinical psychologist and the owner of Craig Counseling Services in Bloomfield Hills. For more than 20 years, Dr. Craig has counseled a wide range of patients across many specialties and is the author of the book, The 6 Husbands Every Wife Should Have, which is now printed in more than 10 languages and is sold in countries throughout the world. Dr. Craig has been interviewed by numerous media outlets, including The Today Show, ABC World News, Tonight, Newsweek, and Time. At Surgeon's Choice, Dr. Craig has led a tremendous turnaround venture, taking the hospital, which is a 74-bed surgical hospital in Southfield, from bankruptcy and crippling debt to a thriving organization with no debt at all, continually improving profitability and a growing base of surgeons, owners, patients, and new services in just over 4 years. Dr. Craig, welcome to Caring for Kids.
Thank you.
It's good to see you in person. And I think we're both vaccinated, so we're as safe as we possibly can be.
It does open up the world.
Yes, it does. Hopefully it'll continue to get better. So I talked a little bit in your intro about your clinical background,
Mm-hmm.
and I thought we'd start there. So tell our listeners a bit about your clinical background and the things that you're continuing to do from a clinical perspective.
From a clinical perspective, I've been a clinical psychologist for more than 20 years, maybe close to 25 years. It's been a while. I've practiced in Bloomfield Hills,
Right.
been doing that for more than 20 years. But it's really a practice that focuses on solving problems, because the way we look at things is anyone can get any issue in their life, but they really need, so we see anxiety, depression, everything, but really from a perspective of let's identify a problem and solve it. Not sort of the come for 30 years for therapy for your whole
Right.
life issues.
Right.
Let's help you get through what you need to get through today.
So if I have a particular issue that's impacting the rest of my life, we're going to deal with that issue versus everything else.
Everything else might come into play. We're
Right.
not going to ignore that.
Right.
But we're really focused on, it's a solution-focused practice of help you solve with what's in the way today and you're struggling with today. And we can go to the rest of it too.
Yeah, that makes perfect sense. And then I have to ask you, over the last year with COVID and all the things we were just talking about, being safe in that, have you seen more issues in people's lives or not?
Absolutely.
Mm-hmm.
Now, I wouldn't say that the pandemic is the problem. The pandemic has revealed the problem more. But yes, the mental health world, it's probably the second crisis that's happening here, the second pandemic, because everyone is impacted by a pandemic. And then everyone's own particular collection of hurdles in life, it gets harder and harder to deal with it with the weight of a pandemic. So in the past year or 16 months since this has hit, we are just inundated with people trying to deal with their own lives and with a pandemic, and then the combination of the two.
Yeah, and then their own lives might, we're talking with Dr. Stephen Craig about his clinical work first, but it also may involve a child. And I just had a conversation with Colleen Allen from the Autism Alliance. So, you have a child with autism, you have mom and dad, you have other siblings, the pandemic, and it's just a recipe for issues.
It multiplies everything.
Yeah.
Everything has been exacerbated over the past year, especially, now I didn't hear your conversation,
Mhm.
but even issues like autism
Right.
is even more difficult.
Right.
Because we've created a stay-at-home environment, and that just adds to the difficulty of people relating to their world in an appropriate way, a healthy way.
Yeah, that's exactly what she was saying. That's awesome. I admire your work and that you're doing so many different things. Now, your non-clinical experience is very diverse, including Bell Tire,
Yes.
which is fascinating, and now Surgeon's Choice. So tell us about that journey, your non-clinical, I'll call it your business journey.
Before I was a psychologist, I had a business degree and worked in businesses, but I never really left that world. So interestingly, even though people call those two different lives of mine different, they're not all that different.
No.
From the business perspective, before I was a psychologist, I was a problem solver. Strategically, go to your business, consult, help you figure out, you're at position A, something's in the way, how to get to position B. As a business person, I've had a 25-year career as well, going to businesses and identifying from a strategic point of view, what's the problem, what do we need to get past, and how do we get you to the other side? So I was the CEO of Bell Tire, come help the company grow, some other companies through the years that you might not know. And now I'm the CEO of Surgeon's Choice Medical Center. It used to be called Oakland Regional Hospital, but it's a hospital that was a small independent 74-bed surgical hospital that had really suffered financially and needed someone to come in, identify the problem, restructure it, figure out what the problem is and what's the path to get through there, and come out on the other side healthy. So I'm doing that with businesses and people, and that's what I'm doing with this business.
That makes perfect sense.
Yes.
So a person has an issue, you help them deal with it. An organization or a business has an issue, you help them deal with it.
Yes.
And they all involve people.
It's all people. Right.
So your clinical work is a real advantage, I think.
Yes.
It helps you because it's the people part that causes problems in businesses for the most part.
It's both of them. It's the people part and being trained to identify the real problem,
Right.
communicate the real problem, and build a path, whether it's a person or a company.
Yeah, I find that fascinating. So Surgeon's Choice, tell our listeners about the services. And I've been there. It's a great facility. It's modern. It's very upbeat. So tell us about what happens there.
It's an amazing diamond in the rough that people aren't aware of. And that's because it had its financial problems in the past and kind of fell through the cracks. but it's a private 74-bed surgical hospital, but it's more than just a surgical hospital in Southfield that's owned by surgeons, but it provides all types of, we have lab, we have pharmacy, we have inpatients, we have rehab, all of the facilities of a regular, what you would call regular hospital, except we don't have an emergency room or an ICU. But what's really special about it is because it's small or medium-sized in the hospital world and private, we get to do it the way we want. It is not like going to a large facility where you need a map to get through and you park 6 parking lots away and that the staff is different and the docs are a number. It's really a personal experience where you know, people who come back are amazed that they have the same nursing staff each time that they came back. Yeah. It's the same people. They're like, "Hi, Marjorie, I was here a month ago for my other knee, and how are you doing?"
Right.
It's a very personal environment that is easy and accessible. It's really a different way to do healthcare because of it's so personal and intimate for the treatment.
And so what are some of the major services provided? Orthopedics?
Orthopedics and sports, so knees and hips and sports surgery and spine and general and hand surgery.
Now, have you seen any difference with the pandemic on your patient base? Just curious.
Not really. The state shut down elective surgeries,
right.
So it was a tough year for that last year, but the mix really hasn't changed.
Okay.
That part hasn't changed.
Yeah. So getting back to your clinical work, your interests, you and I have had some discussions about the Children's Foundation and our interest in mental health. I would say it's our number one focus area right now of trying to solve this crisis that we find ourselves in with young children, with adolescents and young adults, and then adults, of course. And so as a businessman and as a clinician, what are some of the things you think a foundation like ours can do to try to be a helper or a factor in this environment?
Let me use an example to make that point.
That's awesome.
You're going to speak with Gigi here soon, who really is an expert in the developing of programs like this. And as we move to try and create a program I'm going to talk about, she's really the key. But she always describes it this way, which is if someone has a major medical condition, a life-threatening condition, a heart issue, or a major surgery, they go to the hospital. They're there for days upon days, and they are treated in an all number of factors. And then a whole program is built afterwards in terms of nutrition and their ongoing therapy. It's a 2 to 3 week process to get you back to health from your life-threatening situation.
At least.
But in mental health, and especially kids, it doesn't work like that. What happens is it's crisis management. If someone is on a scale of 1 to 10, and at 10 they're suicidal, our system puts them in the hospital until they're down to 9 or 8 and then moves them on. And we're not providing a complete program like we would for other life-threatening situations. So kids especially have such a lack of, as a society, we haven't taught them well to cope with problems. The pandemic makes it worse, but we need programs that actually will address all of the problems that are going on, provide weeks worth of treatment rather than 24, 48 hours.
Right.
That doesn't mean there shouldn't be a 24-hour, 40-hour stabilization unit. I'm not saying that. That's great. But we can't just end right there. Right. And for the groups who are very interested in helping, what we need, there's great clinicians out there, but we need help building a system and funding a system that allows us to provide that level of treatment rather than just put a Band-Aid on it and then the people are back in 2 weeks later into the hospital.
Right. Into the hospital ER.
Again, because we haven't built a full program.
Right. So I heard recently a statistic that on any given day in Michigan, there's 120 kids in ERs across the state in mental health crisis. 20% get placed somewhere.
It's a tragedy.
Yep.
Again, the system is not built to treat this. So they get put in an emergency room.
Right.
But we don't really have a good system to actually provide them with, say, a 7 to 10 day treatment program.
Right.
It's get them there, stabilize them, and move them out.
Move them out.
And then they come back 2 weeks later. So then they're all stacking up in the emergency, which is a terrible way to treat people who are already feel disenfranchised.
Right. And it has a major impact on their family.
The whole system.
Yeah.
Right.
So hopefully the Children's Foundation could, one step at a time, be part of solving this crisis over the years. It's not going to be a magic fix.
Right.
But we want to partner with people like you and Gigi and Colleen to make a difference and tackle it one day at a time.
Yes.
So is there anything else you want our listeners to know about Surgeon's Choice or about any of the things that you're looking forward to doing?
we're really trying to get into helping children more, which is why we
Right.
got together.
Yep.
And build a program that we can actually address what you just talked about. So hopefully that's coming. And that's one of the reasons we want to work with you guys as well.
Absolutely.
Hopefully we can help together solve this problem.
Yes. And so stay tuned, listeners,
Yes.
because we're going to work on that together. So, Dr. Craig, thank you
Thank you.
for being on our show. You do great work, and I'm fascinated by your integrated business and clinical services. So thank you very much. That was Dr. Stephen Craig of Surgeon's Choice Medical Center. Coming up next, we're going to hear from a mental health expert, Gigi Colombini, when Caring for Kids continues, here on the great voice of the Great Lakes, News Talk 760 WJR.
Welcome back to Caring for Kids on WJR. Presented by the Children's Foundation. Once again, here's Larry Burns.
Welcome back, everybody. Larry Burns here, Caring for Kids. As I mentioned, episode 51. So far, it's been great. With me in the studio is Gigi Colombini. Gigi is a clinical social worker who, since 1990, has focused her passion on working with youth and adults who experience trauma, grief, anxiety, depression, and suicide. As an expert in the field of suicide prevention, Gigi has provided extensive education to youth and adults in schools and other community settings. Gigi has contributed her expertise as a team member for the National Action Alliance for Suicide Prevention, helping to review information being disseminated at the national level to be used for community-based suicide prevention efforts. Gigi has consulted on programs for Harvard, Dartmouth, and the University of Michigan. As a psychotherapist, this U of M alum practices at her clinic, the Institute for Hope and Human Flourishing. It's in Bloomfield Hills. And Gigi, welcome to Caring for Kids.
Thank you.
Appreciate it. That's very impressive. And we also have Dr. Craig still with us, so he later on will be part of our conversation, if Gigi lets you.
Well, count me out then.
Right.
I don't know if that'll make a difference.
So as I asked Steve about his clinical practice, and it was a great overview of that, can you give our listeners an overview of your clinical practice?
My son told me last night that basically what I do is in-depth chit-chat. So that's what we do in my clinical practice. With the extensive background in suicide prevention, when I opened up a clinic, the intent was to bring treating suicidality into the outpatient setting because most clinicians, most emergency room docs, very few people actually get any training on what to do about suicide. So the problem is people think they should go to the hospital to get treatment when somebody's suicidal. So they land in the emergency department somewhere, as Steve said, do a short stay, get almost stable in an inpatient setting, or most people don't actually get admitted to an inpatient facility. So then they go back to the outpatient setting, but the outpatient clinicians aren't well prepared for how to treat somebody who's suicidal. So in our clinic, we're trained. We have almost all of our clinicians have extensive background in working in suicide prevention. So not only are we addressing all the anxiety, depression, trauma, grief, but sometimes those things get a person to feel so hopeless that they want to die. So we understand that when someone's at that level, we have to work on reducing the pain enough so we can address the underlying things like every other clinician does. But we don't have to send them away. We're doing that in our outpatient setting.
That's awesome. And one of the things that when we first met that you mentored me on is just some of the language you use. I said, and a lot of people still do, they said, so-and-so committed suicide. And you kind of let me know that that really isn't the best way to say it. So can you talk a little bit about that?
Yeah, the word committed implies something wrong was done, right? Usually it's committed a sin or committed a crime, as if the person who died by suicide has done something wrong, when it really is just simply about somebody's in so much pain, they don't know what else to do to make the pain go away. They may believe they've tried lots of things to make the pain go away, and that the only thing left for them to do is die. So it's not about doing something bad and wrong. So the word committed, when we can take that out of there, particularly for grieving families, they can help. There's some idea that their loved one isn't being viewed as somebody who did something horrible and wrong.
So what would be a better term?
So to simply say things like died by suicide.
Died by suicide. Great. Thank you. That's very useful. And unfortunately, as I was talking to Dr. Craig about the last 16 months and the pandemic and reading, and in my job, I'm a little bit more attentive to the situation, but more young people dying by suicide. And have you seen in your practice an increase in people who are close to that?
For sure. And I also work with people who've lost loved ones to suicide. So people who've completed a suicide or who've died by suicide. So I'm seeing their family members. So yes, it's an interesting thing. There was a conference, a state conference, maybe 2 or 3 weeks ago, and they were looking at suicide in terms of COVID and what's the impacts. And so when there's a national tragedy happening, like September 11th or other things, there's almost a unifying effect that happens in looking at what's going on and trying to understand it. And so we actually see decreased numbers of suicide. So the same thing was happening in the very beginning of COVID. We didn't actually see an uptick in suicide because people were all sort of together trying to figure out, how do we all stay safe? What do we do about this thing we don't understand? The longevity, the anxiety, all the unknowns, then we began to see all the mental health problems that we're talking about in the media. Now, 16 months later, whatever it's been, we're definitely seeing our clinic is so busy. It's a deeply sad thing, the amount of anxiety, the unresolved anxiety that is actually more so than depression, this idea of like, I don't ever know when I'm going to feel better. So we're definitely seeing so much more of that. And that's linked to suicidality.
Yeah. Losing hope that things will get better. We're talking with Gigi Colombini, who is a psychoanalyst. We're talking about her clinical practice. And the audience for Caring for Kids in WJR is mostly adults. And so somebody may be driving home from work or just listening in their kitchen that's a parent, a grandparent. What are some, and Steve, feel free to weigh in if you want, what are some of the signs that a youngster or a young adult is thinking about suicide? And what are some of the signs? And then the next follow-up question is, what does the parent, grandparent do if they think something might be wrong? So Gigi?
So when I'm teaching parents, grandparents, adults about how do we help with this, it's really prevention, preemptive, because we're often confused by the signs we might see with young people, particularly adolescents, right? There's the upset and the angst that goes with being in adolescence and maturing and separating from parents and things like that, and the snarkiness. And so we might look for some of those behaviors as well as possibly dropping out of sports or things that they love doing, or maybe that their grades are not where they were and they're struggling with school, or they're not wanting to attend school during non-COVID normal times. So all those things can mean that there's something emotionally going on with somebody. But in terms of suicidality, sure, there are specific things, because we will hear people spit out things like, oh, I could just kill myself because so-and-so saw that Snapchat, or things like, I don't think I can do this any longer. So there'll be some language that we might hear, or we might see drawings. We might see, it still happens where people give their, prized possessions away. But really, the best thing any of us can do, if we can think about it in terms of the conversations we need to have with our family members, our kids, just like we have the conversation, hopefully, about substance use and don't use drugs and all that. And ideally, we're controlling the conversation around sex with our kids, so they're not just hearing it on the playground or on some video. We need to include in those education conversations emotional well-being, that depression and anxiety happen. Those feelings happen. Worry, sadness are normal if they go on for too long, or they're acute, like thoughts of suicide. Then we go and get help, just like we would if you were having a medical issue in your body.
Right.
And the only way that we can actually know if somebody's suicidal, although somebody kicked me an article yesterday about blood draws for suicidality, we'll see. But the reality is the only way we can know if somebody's suicidal is to ask. It is so important for parents, to have the conversation of, if you or anybody you know has thoughts of suicide or you're worried about them, come talk to me about it. There's lots of help we can give if we know it's going on. Most of the time, the conversation stays at the kid level because the kids don't want to upset the parents by telling them that they're feeling suicidal. So the parents initiate the conversation, use the word suicide. Because when we avoid using the word suicide, the kids get the message that we don't really want to talk about this. But this one is life and death. We need to talk about it.
Yeah, great advice. Any thoughts, Steve?
I was just going to add that she schooled you on how to speak about it, and
Right.
she schooled me on that same thing.
Good.
Through the years, that you have to talk about it or else you're adding to the stigma.
Right.
And talk to them, and it makes a giant difference.
Yeah, great. So I asked Dr. Craig this, and ask you, Gigi, this is the Children's Foundation. You know, we have 120 some partners. Mental health is, I'd say, our number one focus area right now. We can't change the world. We don't have enough money to do massive things, but what kind of things should we be thinking about trying to help with on the things that you see on a daily basis?
I think Margaret Mead said that a small group of people have always changed the world, but we will do what we can. I think a part of the problem with mental health, and particularly suicide, but also in mental health, is the disconnect. Like, we're not all working together. Whether it's the community people, the schools, the outpatient providers, the inpatient, we're generally not talking. Maybe some with the family, but then this family that's in crisis because their kid's in crisis is left to explain to the other professionals what was said in a conversation that's not often had because people aren't talking about mental health stuff until it's really a part of their family. So it's imperative that we work together, right? It's like we're an ecosystem. We're keeping things in balance together, particularly the youth, right? So as an outpatient provider, I communicate with the schools and the families. I mean, I think it's so important if they've been inpatient, the ideal inpatient settings are actually communicating with me as the outpatient provider for what do I see if I've been working with the person for a while because they've landed in their office and it's a history probably that got them there. So some understanding. So when we're working together, we can actually be much more effective. And I think that needs to change.
Well, that's what we're trying to do, work together. Nothing is more rewarding to me when partners of ours, grantees, who maybe haven't known about each other, come together and actually have a discussion and do things together. That really is making 1 + 1 = 3 or 4. And that's what we're all about. And that's what we're going to hopefully do with you, Gigi, Dr. Craig, and then keep our listeners up to date on what that partnership might be looking into the future. So I want to thank both of you for being on the show, our 51st show. You made it very special. There's no more important topic right now than mental health. And to have experts like you on makes this show a very relevant show. So thank you. Appreciate it.
Thank you.
Yep.
Thanks.
Yep. And thanks for listening, but don't go away because I'm going to have some great information about the Children's Foundation and our activities coming up when I return. All righty. Well, that was a great show, number 51. Hopefully we'll have 51 more. Wanted to give you an update on some foundation activities. We held our second Child and Adolescent Behavioral Health Summit earlier this month, and it was a great success. It was virtual, and it was very successful. So thank you to our sponsors, in particular Blue Cross Blue Shield as the presenting sponsor, and for those who attended that made that event very special. Coming up on May 1st is our 5th annual Derby for Kids event, to be held at the wonderful Country Club of Detroit in Grosse Pointe Farms. It's going to be a great day of fun. And most importantly, it's raising funds for pediatric cancer research. Tickets are still available. Get yours today and simply go to our website. We have a great auction, a silent auction that's live now. It will be a safe outdoor event with heaters if needed. It'll be a great event. Mint juleps, bow ties, hats, all for a great cause, supporting the Children's Hospital of Michigan and Mott Children's Hospital. So thank you for joining us on Caring for Kids. Look forward to hearing from me next month. Onward.
Caring for Kids with Larry Burns on WJR has been presented by the Children's Foundation.